Welcome to Nurse Educator. Learn with me. Cardiac cycle. Cardiac cycle is the performance of the heart. It happens from the end of one heartbeat to the beginning of the next heartbeat. Each cardiac cycle takes about 0.8 seconds to complete and it has two periods, diastole and systole. The two periods in the cardiac cycle are cardiac systole and cardiac diastole. Cardiac systole is the period of contraction and pumping of blood. It is mainly two types, atrial systole and ventricular systole. The atrial systole is the contraction of the atria that causes the ventricular filling, and the ventricular systole represents the time during which the left and the right ventricles contracts and eject blood into the aorta and pulmonary artery. During systole, the aortic and the pulmonic valves open and the atrioventricular valve closes. Cardiac diastole. It is the period in which the heart muscles relax and refills with blood. As we know, the right atrium and the left atrium receives deoxygenated blood from the vena cava and the lungs. Blood flowing from the right atrium and the left atrium to the right and the left ventricles through the atrioventricular valves, that is the mitral and the tricuspid valve. At the end of the diastole, both atria contracts. Phases of cardiac cycle. There are 7 phases in cardiac cycle. They are atrial contraction, isovolumetric contraction, rapid ejection, reduced ejection, isovolumetric relaxation, reduced filling, and rapid filling. Atrial contraction. This is the first phase of cardiac cycle. It is the electrical depolarization of the atria. In ECG, it is represented as P wave. When atria contracts, the pressure within the atria increases and more blood passes through the atrioventricular valve into the ventricles. The atrial contraction causes a small increase in the venous pressure, and a heart sound noted during the atrial contraction is S4, that is the fourth heart sound. It occurs due to the vibration of the ventricular wall due to atrial contraction. The atrial contraction accounts of 10% of the ventricular filling. Passive ventricular filling occurs prior to atrial contraction, that is 90% of the ventricular filling occurs passively. When a person has high heart rate, there is less time for passive ventricular filling, so 40% of the ventricular filling occurs by atrial contraction. After atrial contraction, the atrial pressure begins to fall and the atrioventricular valves float upwards. At this time, the ventricular volume is maximum and it is known as end diastolic. The second phase of cardiac cycle is isovolumetric contraction. This phase represents ventricular depolarization. It begins with the appearance of QRS complex in ECG. There is a rapid increase in intraventricular pressure. When the intraventricular pressure exceeds the atrial pressure, the atrioventricular valve closes. Ventricular contraction also causes the contraction of papillary muscles and chordae tendineae of the valves. There is no change in the ventricular volume because there is no ejection of blood due to the closed valves. So it is termed as isovolumetric contraction. Closure of the AV valves results in the first heart sound, that is S1. This sound is normally split because the mitral valve closure precedes the tricuspid valve. Next one is rapid ejection. This is the rapid ejection of blood into the aorta and pulmonary artery from the left and the right ventricles. The ejection of blood occurs when the intraventricular pressure exceeds the pressure within the aorta and pulmonary artery. This causes the opening of the semilunar valves, that is the aortic and pulmonic valve. In this phase, the ventricular pressure exceeds the aortic and the pulmonary artery pressure. No heart sound is noted during this phase because the opening of the healthy valve is silent. If there is any sound, it indicates a valve problem. Fourth phase is reduced ejection phase. After depolarization and the beginning of the ventricular contraction, ventricular repolarization occurs. The repolarization causes a decrease in the ventricular pressure. Fall in the ventricular pressure reduces the rate of ejection. The left and the right atrial pressure gradually increases due to the venous return through the vena cava and the lungs. The next phase is isovolumetric relaxation. At the end of phase 4, the intraventricular pressure falls and the aortic and pulmonary valves closes. This causing the second heart sound S2. After the closure of valve, there is a rise in aortic and pulmonary artery pressure followed by a small decline. The pressure decreases but the volume do not change because all valves are closed. The volume of the blood remains in the ventricles is called end systolic volume. The left atrial pressure continues to rise due to the venous return. Rapid filling. This is the sixth phase of cardiac cycle. Due to ventricular relaxation, the intraventricular pressure falls below the atrial pressures. At this time, the atrioventricular valve opens and begins ventricular filling. When the complete relaxation of the ventricles occurs, their pressure will slowly rise. The ventricular filling is silent. Sometimes a heart sound S3 can be audible. It is normal in children. The opening of the mitral valve causes a rapid fall in the left atrial pressure. The last phase in the cardiac cycle is reduced filling. Ventricles continues to fill with blood and this raises the intraventricular pressure. This reduces the pressure across the atrioventricular valves and this reduces the rate of filling late in diastole. The ventricle fills 90% by the end of this phase, that is 90% of the filling occur before atrial contraction. As we already discussed, only 10% of the active filling occurs during phase 1 or atrial contraction. Aortic and the pulmonary artery pressures continues to fall during this period. The key points to remember are the cardiac cycle is the relaxation and contraction that occurs as the heart works to pump blood through the body. Heart rate is used to describe the frequency of cardiac cycle. It is calculated as the number of contractions of the heart in 1 minute. Every cardiac cycle has atrial systole, ventricular systole and cardiac diastole. Complete cardiac diastole occurs after systole. Throughout the cycle, the arterial blood pressure increases during the phases of ventricular contraction and decreases during the phase of ventricular filling.